Welcome to our Dental Business Transaction podcast, and my guest today is the fascinating Louis Mackenzie, or as I like to think of him, is one of our very own dental Peaky Blinders. So, firstly, Louis is a general dentist. He is head dental officer at Denplan and a clinical lecturer at Birmingham School of Dentistry and King's College London. So quite a career, I think, spanning over the last how many years, Louis?
Now 32 years, but I suppose if you take me back to when I started at dental school, I started in 1986.
1986. I was 6 years old then.
Well, that's really got us off to the wrong sort of start.
And part of the reason it's, I find it fascinating is you have lived through, lots of change in dentistry and, been in the journey from education and dentistry yourself through to your role now in helping young dentists in education themselves. So I'm not trying to say you're old, but, I wanted to try and pick your brains today. I think one of the most fascinating pieces of information that you shared with me before this was that you've worked in the same practice for 30 years?
32 years, yeah, now. Yeah, so obviously that is pretty unusual in dentistry, certainly in my era, where quite commonly you'd move around a few practices to begin with. And obviously nowadays it's common to work in multiple practices at the same time. But yeah, I was just lucky that I started. It was before vocational training, before foundation training was compulsory. So I just went in as an associate, and myself and my boss David Payne hit it off literally from day one. It became really good friends, and we played cricket for the same team for 20 years as well, and he and his family are still good friends. So he's just really lucky to just have that relationship right at the start.
Why do you think? Well, it's certainly at the top of my psyche at the moment. Why are so many dentists looking to transition to sort of solely private? Do you think? What are the drivers?
Over the last 20 years where I've been in dental education, I've asked that question of lots of dentists who have made that transition. I've done over a sort of 1,000 hands-on courses now, which are really a fantastic opportunity to chat to colleagues working in different areas of the country, different types of practices. And so I've asked that question a lot. And the word that always is mentioned in the last 20 years of the thousands of dentists I've spoken to, the most common driving factor is time, and it's time with patients, just time to make good notes, time to do the treatment that the patient it will most benefit from, time to think about stuff. But also on the flip side of that as well, working in private practice actually gives you that life-work balance back, because once you remove those targets, once you remove those limits, that you're in total control of your own career. Because when Denplan was set up, there were basically three drivers. It was back in the 80s. I don't know if you've watched the not the recent season of The Crown, but the season before that. The 80s were a time of absolute upheaval nationally. Obviously, you were hardly born at that stage.
I did go on an anti-poll tax march, though, Louis.
Oh, well, there you go. There you go. So it was a real time of upheaval nationally, mass unemployment, record inflation way beyond what we've got at the moment, and that's bad enough. And it was a tough time in dentistry as well. So the profession was looking for something different. And Denplan came along in '86 and was basically founded on three principles, which are just as true today as they were way back then. And the first one was to actually give dentists and practice teams control of their professional careers. The second one was to create an environment where quality patient care was at the foremost, and the third one was to actually align the dentist and the patient, where the focus is on prevention and minimally invasive dentistry. So getting away from sort of activity-based remuneration, actually getting paid to keep patients healthy.
Just taking, so you're in practice, you're working with your patients, but I guess you have a lot of contact as well with young dentists through your lecturing and your clinical lecturing role. How have you seen sort of the young dentist cohort sort of change over the last 20 years since you've been involved there?
Again, though, that's been one of the most enjoyable bits of my career is working in undergraduate teaching. That was my first sort of move into teaching, was to just teach on a final year clinic, just on a Thursday afternoon. I started off, and I just really liked it straight away. I was just sort of testing it out, really, and just immediately I sort of liked the fact that you could like really help lots of young dentists at a stage. I remember I was really lucky, had really good tutors when I was at Birmingham, and had a very positive learning experience. And I think, in fact, there are quite a few people in my year have actually gone back into dental education. Some of them full time as well. So I think we were lucky that we had a really nice era where we had some really great sort of inspirational tutors, and I've experienced what they experienced, was actually sort of helping young dentists, because it's a tough course. It's 5 years nowadays. It was only 4 years and 1 term when I did it, but it's a tough course, and so I really found it very rewarding helping helping young dentists or young dental students become passionate about dentistry. And been really lucky. I've worked with some absolute geniuses as well, who are now internationally famous lecturers. So I go to their lectures and webinars now. So I've to answer your question, I've seen my students become my teachers.
You talk about sharing passion. I guess, where does your passion for dentistry come from, that you're able to share with those dentists through education? Where's your passion come from?
I think it's actually the job itself.
Mm-hmm.
I really like dentistry. I really like being a dentist, and I really like chatting to other dentists as well. You see it all the time. We're a strange bunch, but I think in a good way. So the passion, I think, really comes from the practical aspects of doing it, fixing things, helping patients, solving problems. Been really, really lucky that literally in almost exactly the 30 years that I've been working, we've seen this just absolute explosion in aesthetic and cosmetic dentistry as well. So that's become a real sort of passion for me as well. And of course, it's massively popular, particularly so nowadays, is actually having aesthetic or cosmetic dentistry as part of your day-to-day dentistry as well. And the leaps that there have been, particularly with direct composites techniques. So now there's almost nothing that you can't do yourself to restore teeth.
I was lucky enough to sit in on Simon Child's lecture at the recent Denplan forum, and I'm not a clinician, but oh my goodness, what you can achieve in dentistry now, it's absolutely fascinating. When I was younger, I fancied being a doctor, but I'm actually thinking maybe there's a missed opportunity in dentistry.
There's still time, Abby, because you're so young. If you want to pivot to dentistry, in fact, we're getting a number of medical colleagues and even vets sort of pivoting into dentistry. I think obviously all the healthcare professions have got issues, and obviously we're so focused on dentistry, but I think, you know, dentistry is, it's a fantastic profession, and I mean, it's so all encompassing. It's such an intense sort of job, and I think sometimes we forget to list all the benefits that it gives us, from a, you know, from personal rewards point of view, and it's easy. It is easy to overlook the positive aspects.
Interestingly, you said about you were always like that. You know, were you always like that? And when did you decide, you know, dentistry was for you?
Well, that is was the subject of controversy. I always thought, I decided I wanted it to be a dentist when I was 11, which is obviously no reason for that. Nobody in my family was ever sort of in any sort of healthcare profession. But my auntie, religiously, I mentioned this on a previous podcast, actually. Yeah, my auntie had insisted that I was about 6 when I first said I wanted to be a dentist, and so I thought, no, how could that have happened? But one of my uncles, who was in his 90s, I went up to visit him in the Lake District just before the pandemic, and he said, "Yeah, you were." I was about 6. So, and once I decided I wanted to be a dentist, I never changed my mind.
Mhm.
I basically just focused entirely on that, chose my O-level subjects accordingly, chose my A-level subjects accordingly, had to drop things that I enjoyed, things like arts and woodwork, and which would have been fairly useful, I think.
They're the hobbies for the future there, Lewis.
Yeah.
Hopefully you
So,
haven't dropped them completely.
oh, I've actually taken taken them back up again in the pandemic. Yes, I'm on a project at the moment of portrait drawings, 100 heads. So I'm up to about 85 now. And in fact, going back to where we started, also having that time, I think it's almost like we've had a reset, isn't it? That I think everybody's looking at their life work balance. You must be getting into these conversations all the
Yeah.
time, where people have been literally running as fast as they
Mm.
can for years in a practice, the whole team, and suddenly been forced to stop. I think a lot of people have literally just reevaluated not just their dental careers, but their whole lives.
Actually highlighted it during the pandemic, you know, stopping and thinking, what do I want to do with my life? What do I enjoy doing? But it's an incredibly important part of when I'm working with dentists leading up to their sale. How do you see people that have kind of retired? Because obviously you're potentially sort of wound down your dentistry, but after somebody's finished their practice, what advice would you give them to keep sort of connected if they're not working clinically anymore with their community and their culture and their colleagues?
I mean, that is such a good point that you bring up as well. And I've noticed this over the last 20 years as well, chatting to, you know, literally thousands of dentists who are coming up to or making that transition. And it was one of the things that really polarized my opinions about purely NHS dentistry and private and mixed practice dentistry, because I chatted to so many dentists who were literally just almost literally flogging themselves, seeing you know, sometimes up to 80 patients a day, but certainly on average sort of 40 patients a day. And literally, even sort of fairly youngish dentists just literally almost counting the days until they're retired and they could take their pension. And then equally, I'd go to Denplan courses and I chat to dentists way older, you know, sometimes way beyond retirement age, literally having the conversation, and on occasion almost in tears because they had to retire, because they were so passionate about their jobs, and almost being a dentist actually was part of their identity as well. And so a real sort of almost fear of suddenly that being switched off. That obviously creates a risk of holding on a little bit too long. There's no doubt about it. Dentistry does become more difficult as you get older. Eyesight gets a bit rubbish. and manual dexterity as well. But from an experience point of view, it is a job that you can continue to do to a very high level till you're really, really old. And so I'm hoping to sort of answer your question that sort of enforced pause probably has made everybody think about their whole lives and their families and how they're going to use their time on earth, and what they're going to do when suddenly dentistry is switched off.
You say every single minute of your day and your working day is scheduled, isn't it? When you're a dentist, and the rhythm of that and the kind of the engagement all through the day, that is a big adaptation. So I'm a real believer in setting yourself up for that point in time when you do retire, reducing your days, bringing an associate in to sort of take on new patients or hand over some of your patients as well, and gradually sort of acclimatize yourself, I guess, to moving away. And that can be a very, very good thing for your sale as well, because one of the things that buyers are very cautious of, and market value is dependent on, is a practice is completely dependent on the owner.
Yeah.
So it makes sense from getting the best results from your sale, but more importantly, helping to adapt to my identity as a practice owner and as a dentist and a clinician to what is their outside work that I want to do, what I choose to do, and what I love to do.
Yeah.
Because life's got to be meaningful after dentistry too. But then,
that's such
again,
brilliant advice.
I see dentists still coming, that have retired quite a few years ago, coming to all the shows and the exhibitions. They want to keep their hand in. They want to see what's going on with the latest toys, meet up with their colleagues. So, there are plenty of opportunities to stay connected with your profession.
I'm say it's a lot of my mentors are reaching retirement age, and some of them are retired as well. But they're still most definitely involved. One of my key mentors, a chap called Adrian Shortall, who was the head of conservative dentistry at Birmingham. He literally took me under his wing when I was sort of getting into teaching. Didn't really know what I was talking about, and he really was pivotal in my development. He and Trevor Burke in particular. But Adrian, now he's been retired for it's probably getting on for about 8 years, but I still get emails from him. We usually it's usually film suggestions is at the front of the email, but then he will also attach a number of papers that he's selected from various journals that he still subscribes to, that are sort of the key developments in different areas. So you can retain that passion and interests actively, because there are so many developments in various different areas, and of course there's so much good content available online now. It's really easy to stay connected to the absolute best speakers on each particular subject. Again, like the series we've got going at the moment, that finishes next week. I've watched every single one of the lectures, even though some of the subjects are something that I haven't got any interested in some examples. Orthodontics has always been an absolute mystery to me. But I've watched all of the lectures, and when people talk passionately about a particular subject, it's really engaging as well. And I don't listen to many podcasts. I don't do many podcasts. So thank you for this kind invitation, because I like that sort of visuals as well. But I'm definitely better for radio than on the telly anyway.
I think you're looking pretty cool there in the studio, Louis. You wouldn't know that you don't do many podcasts, but something that's really, really clear to me is some of the key people that have influenced you, mentors and clinicians over the year, the positive experiences that you've had. and now you're giving those positive experiences and guidance to the young generation of dentists, and absolutely how excited and passionate you are about the dentistry profession. And you know, sometimes I'm talking to people with some of the tough things about working in dentistry and practice, but you know, something that's really clear to me today is how exciting dentistry is, and how much is out there, and how much opportunity there is to stay excited about doing dentistry. And you know, if I was 10 years younger, you never know, you might be enrolling me onto the dentistry school in Birmingham.
Well, we're more than happy to take mature students, and you would fly through the course with your knowledge of dentistry.
Yeah, and if you know, if anybody wants to talk to me, my favorite kind of subject is about planning, obviously to get the best outcome of yourself, but more than that is planning how you want to exit your business, and then what you want to be doing with your life afterwards. So that's what I'm really passionate about. So if anyone wants to talk to me, I'm all ears.
Perfect. And again, from the feedback that I always get from the conversations that people have had with you and your team, you're definitely doing everything right to actually help that transition, because these businesses, and I've seen this so many times. I mean, I've never done it because I've never had the business skills, the business knowledge, or the motivation. But these businesses have literally been built by hand in many cases, from scratch, over 3, 4, sometimes more decades. And so they're part of the family. They are so precious. And so the work that you and your team do in actually easing that transition from one owner to another owner, or sometimes to multiple owners, you know, you're doing such a valuable job for the profession, because these are precious commodities, and I'm not meaning at all from a financial point of view. Of course, they are, you know, really successful businesses, but it's actually managing the personnel and managing the relationships as well. You know, so the work that you do, I can't even begin to imagine how difficult it is. But the work that you're doing is absolutely critical part of the profession.
Well, we're riding the emotional roller coaster with our dentists, you know, day to day, because it is something that's been built, like you say, which is valuable because of the people in the business, the culture of the business, the ethos of the business. And like you say, some of them, people set their practice up from scratch, or bought it many years ago, and it's really part of their life. Yeah. So we could talk forever on this subject, couldn't we? I'm sure, Louis.
Yeah.
And with
you've made this very painless.
Your knowledge spanning three decades. It's like when I went to the Bristol Air Museum. It's just seeing the progress from sort of wooden biplanes through the war. Obviously, there was some reason to advance very, very quickly, but to see the amazing feats of sort of engineering and progression in a relatively short time. And my impression of dentistry is, you know, the acceleration and the progression, and what there is, you know, the techniques and evolution in dentistry is just fascinating in itself. So thank you so much for sharing that with me today, and it's been a pleasure having you here as our guest. I'm sure we can pick up this offline sometime.
Thank you, Abby.